field of medical practice. He is a friend, a brother. I can gladly call him a classmate. He's a gentleman. He's not like some of us who are rough like that. You know, he's a gentleman. And he goes by the name Dr. Duke Kwaku Agbodeka. He's an internal medicine resident at the Korle Bu Teaching Hospital. He works at the Greater Accra Regional Hospital, that's the Ridge Hospital. Please help me welcome my brother Duke to share with us on the topic stroke. Duke, over to you.
Okay, Dr. Sedonia, thank you very much for this invitation. I know your followership is very hungry for knowledge and hungry for things that concern health, and I am privileged to be on one of those panelists that can share this information with them that would go a long way to help them. Okay, so as he has said, I'm Dr. Duke Kwaku Agbodeka. I'm an internal medicine resident with the Greater Accra Regional Hospital. And I'm going to share about stroke today. It's important that we deal with this topic because it's killing a lot of us, it's killing a lot of Ghanaians. And as we go on, I'll share some very horrifying and very terrifying statistics from articles that have been published and from my own experience in the emergency room of the Greater Accra Regional Hospital. So let's go ahead. So this will be my outline. Would delve slightly into the basics of stroke, how common stroke is, who can get a stroke, the causes of stroke, how it happens, its manifestations, recognizing the symptoms, and how to prevent a stroke. We'll talk a bit about some important risk factors of the causation, that is hypertension and diabetes. We'll talk about how to diagnose, how to treat stroke. Okay. So when we say a stroke, what are we saying? The brain relies on a constant supply of blood, okay? And the blood vessels, as we'll come to see in the presentation, come from the heart and then gradually narrow into small blood vessels that supply the entire brain. So when we say a stroke, it means that there's some interruption in this blood flow to the brain or parts of the brain. And this blockade or this interruption of blood flow can either be a blockade or a rupture of a blood vessel leading to some parts of the brain. Now take it like that you have a huge pipe supplying several houses, and just before they supply the house, there's a huge breakage so that blood doesn't flow to these houses. That's one type of stroke. Or you have a blockage, something actually inside that pipe system that prevents blood from reaching the houses. So technically, that's what we are talking about. It's an interruption in the blood flow that supplies brain cells. Now, you know that if cells in the body don't get oxygen and nutrients, they die off. It's the same with the brain, okay? And it's very important that we recognize stroke quickly in very sophisticated parts of the world. Stroke is recognized quickly and can be reversed, especially the ischemic stroke. The bleeding type, not so common to deal with its complications, but then the type that has a clot blocking the blood vessels, if it's identified quickly, chances are that you can reverse the stroke. Okay. So to explain it, as I've already said, you consider it like what we see in a heart attack. When we say somebody has had a heart attack, it's when blood ceases to flow to some part of the heart, and then the heart muscle dies off, and that causes excruciating pain. the person falls down because the heart is no longer performing its function. It's the same thing with the brain. Okay, so there's some interruption in blood flow to some parts of the brain. Now, recognize that the brain is a control center of our body. It's responsible for cognition, for you to read and for you to understand, interpret everything that any sense that your body gathers. Okay, it's the control center for our thoughts, our movements, our emotions. So when you have brain cells dying off, that means that these functions are going to be impaired. It's very unlikely that you have the whole brain having a stroke though, but then you have some part of the brain having the stroke. And that part of the brain where the brain cells die off, they go away with their functions, okay, because they've died off. And where stroke is not quickly attended to and the brain cells actually die, it's not possible to do anything about bringing sort of like bringing those cells back to life. So then those functions are lost. The brain may try to compensate by allowing other brain cells to try and perform the functions that have been lost, but then you would always recognize that the person is left with some deficits. Okay. So how common is stroke? So stroke is a significant worldwide concern affecting millions of people each year. And according to the World Health Organization, it's the leading cause of death globally and the leading cause of long-term disability. Okay. Worldwide, 15 million people get a stroke each year. And the incidence rate of a stroke in Ghana is 14.19 stroke events per 1,000 person years. That means that if you take 1,000 Ghanaians and you observe them over a year, 14.19 of them will get a stroke. That's how bad it is. Now, if you take a look at the data I have put there, below 40, you have the events at a very low incidence. But then when you get to 40 to 49, then it comes to 9.5, and that's where it all starts. And then it begins to ascend like that. Okay, 80 years plus, it's up about 16 events per 1,000 person years. Okay, and if people who have hypertension and diabetes, if you took 1,000 Ghanaians with hypertension and diabetes, 16.64% are likely to have stroke. Hypertensive alone, 13.77, and diabetics, 9.81. So stroke can happen to anybody regardless of their age, gender, or race. Okay. And while it's common in the adult, it occurs more commonly in younger individuals. And when it occurs in younger individuals, it is much more drastic and much more complicated. And the young ones lose their lives. So I'm talking about young adults between 20 years and 40, 50 years, because I mean, when they get the stroke like that, because of the risk factors that might have led to getting these strokes, their complications are much worse. So we would come to talk about certain risk factors that predispose people to getting a strokes, and we'll come to that soon. The underlying causes of stroke are related to problems of the blood vessels, which I've already spoken about. So it's either an interruption, it's an interruption of blood supply, and these issues arise from commonly what we call atherosclerosis. I'm sure you've heard this term before, although it's technical. The meaning is that fat deposits in the inner parts of the huge vessels narrows the vessel. So when it narrows in that way, you have blood sluggishly going through that narrow lumen of the vessels, and clots easily form. This will usually happen in the big vessels. So these clots would move and block the small tiny vessels in the brain and cause a stroke. So that's the most commonest type of the stroke, where you have a clot blocking a blood vessel. Then you have this same atherosclerosis causing weakening of the vessels and other causes, not just the fat depositing the vessels as well, but other causes that weaken the blood vessels, and it may cause rupture of a major blood vessel supplying the brain with oxygen and nutrients, and causes interruption of blood to the brain. So if you look at this, I don't want you to do anatomy, but then this is just here, which says the aorta. Aorta is from a major blood vessel from the heart, and from it you have big vessels that gradually narrow into the small vessels in the brain. This, what you see here named as a circle of Willis, is what you find in the brain, supplying various parts of the brain. So you can have a clot blocking a lot of these vessels here, okay, and interrupting blood flow. Okay. So how does the stroke happen? Ischemic strokes, as I've said, is a blood clot. So a clot might form in a big part here. I hope you can see. Let me see if I can use a laser pointer. You can have a clot blocking or forming somewhere here in one of these major vessels, and then it travels and comes to block some of these small vessels, and its effects, it's very deleterious. Okay, so that's major type of the stroke. Accounts for up to 85% of all strokes, and I said that one, if you get that type and it's recognized quickly, you need to do a brain imaging. If it's recognized quickly, you can reverse it. You can reverse the blockage before the brain cells die. Okay, there's some time span where blood supply doesn't reach the brain cells, but then they survive to some point, and in the hope that the blockage is reversed. The hemorrhagic strokes, as I said, occurs when weakened ruptured cells, ruptured blood vessels occur, and then so there's interruption in the blood supply. So basically, this is the hemorrhagic stroke. You have a ruptured blood vessel, so you can see bleeding into the brain tissue, okay, outside the blood vessel. So the blood is supposed to be flowing from here, going to other parts of the brain, but then you have it bleeding into the brain tissue. And blood is toxic to the brain tissue, would cause damage to the brain vessels, the brain cells. And because the blood is leaking from here also, cells that are distal or far away from here that should need the blood supply will not be getting. Okay. The other type, and the most common type, as I said, 85%, is where the clot blocks blocks a major vessel here. And so you can see that this area has a darkened hue compared to the other parts of the brain. And when the cells appear dark, they are dead. When you do a CT scan, a brain imaging, and you find that the cells appear dark, there's nothing else you can do. There's no need attempting to go and reverse the blockage. Okay, so the risk factors, they are divided into the modifiable and non-modifiable. So the modifiable ones, as you see here, are hypertension, obesity, atrial fibrillation, which I will explain, diabetes, cardiac disease. Dyslipidemia means, in this case, we are talking of high blood cholesterol, excessive alcohol intake, physical inactivity, sitting down at one place and calling people to do things for you when you can't do it yourself, and smoking, stress, poor diet. Okay, the non-modifiable ones are age. So as you saw, as the age ranges went high, the people had higher risk of having a stroke. Gender, male gender is at most at risk. Family history. So if you have a direct relative who has a stroke, you're at risk. Ethnicity, here they say ethnicity, but I mean, from studies, being part of the black race is a risk factor enough to get hypertension and to get a stroke. And if you have had a stroke before, the likelihood that you get it again is very high. If you take a look at this top picture here, you see this man's abdomen. So the measurement of his abdomen, his waist is supposed to be around the navel. The navel is even sagging, so they are measuring above the navel. But that's where the waist is. And the waist, ideally, the hips should be bigger in circumference than the waist, that Coca-Cola body shape. But if you have it the other way around, where the waist is bigger than the hip circumference, that's a risk factor that we've identified to be associated with a stroke. Okay. So the typical manifestations of a stroke would depend on the area and the severity of damage, of the brain cell damage. Okay. And commonly you would find that people will present with all sorts of symptoms. Okay. So you would have a droopy face, or what we would identify that when you divide the face into two, one side of the face is not symmetrical to the other. So the mouth is open and drooling saliva. The person may not be able to speak. There's some profound numbness on one side of the body. Okay. And it is so discomforting that you can't do anything. You can't even sleep. There's a profound headache, blur vision, or loss of sight. And then balance, you are walking and you realize that you are swaying, like the wind is blowing a leaf in the air. Or just loss of consciousness. When somebody is supposed to have woken up by 7 a.m. and then it's 12 p.m. in the afternoon and the person hasn't come out in the room, you go and you find him unconscious. It's not only stroke that can cause that, but it's a symptom of stroke as well. Okay. So this is some things to help spot stroke quickly. Okay, you ask the person to smile, and you realize that when the person smiles, only one side of the face is moving. You ask the person to raise his or her arm, and the person can't, or can weakly raise one side of the arm on one side, raises it just slightly compared to the other side. Or you ask the person to speak, and the person is fumbling or making incomprehensible sounds. The last thing is the time. As soon as you identify that, here it says 911, you should call an emergency number. Okay, if you can get an ambulance to get to your household and rush that patient to an emergency facility, it is very important. If you can't, please try and get that person in a vehicle and rush to the hospital. So how do we prevent stroke? Healthy lifestyle, regular exercise, balanced diet, avoiding smoking, and taking alcohol in moderation, please. The part of the world we live in is so dangerous. I mean, I don't say this condescendingly, but it is what is prevailing on the ground. When you have to quickly get the patient to the hospital and then start imaging processes so that you can tackle this issue of a stroke. In our part of the world, you'll be running from facility to facility, even looking for a bed space to admit your relative. And you can't afford to live a risky lifestyle in the part of the world we are living in. So please, I work in Ridge Hospital and in the emergency once every week and one weekend every month. And by the time the duty is over, my team would have admitted about 12 to 15 patients. Half of those patients would be stroke patients. 3 of them will be young adults. And by the time we would have ended the duty, half of those stroke patients would have died because a lot of them we can't do anything about. So please, regular exercising, we can't emphasize emphasize it enough. You need to have a healthy lifestyle in terms of your eating. Lots of vegetables. Those of us who don't like vegetables, they say when we say eat vegetables, then they say it's like a sort of a condescending thing, that it's grass and leaves and all that. They contain nutrients that we don't even need to boil these vegetables. We need to get them in their raw state and get the nutrients in our bodies to help prevent these complications that come with the deposition of fatty substances in the blood vessels and all. Processed foods, sugary foods, excessive salt intake will not help you. The things that we get on the over the counter, the thing is already processed. They are preserved with a lot of chemicals that help to prolong their shelf life, but they cause us hypertension. They have a lot of these things are salts, and it's not helpful to us when we consume huge amounts of it. So we have to be careful. So you have to have a regular life, physical activity. Try and avoid being in one place where you can walk or climb the staircase. Do so and avoid the elevator. Don't be angry with the trotro for dropping you earlier than the spot you were supposed to alight. Walk. Get out of bed. Aim to achieve 150 minutes of moderate physical activity per week. Now, if you go on Google Play or iOS, there are step counting apps. Always, I have one. I try to achieve at least 6,000 steps a day. If I haven't, by the time it's getting to evening, the AI of that app will try to alert me that I have not achieved this number of steps in a day. You need to be physically active. Controlling high blood pressure, high blood sugar. If you're hypertensive, if you're a diabetic, please, it's important to adhere to your medications. Regular visit to your doctor. Avoid unhealthy habits. Alcohol doesn't help this class of patients, please. If we say moderate, alcohol in moderation for the general population, for you, it's scanty alcohol per week. Okay, and as much as possible, if you have to take it, let it be just during occasions. It's essential to monitor your blood sugars, monitor your vitals. You should know your figures. And when I say your figures, you should know your weight, your height. You should know what your cholesterol is, your cholesterol level is this year, what your regular blood sugar, what your regular blood pressure is. It's very bad when I see some of our, when I see patients in the consulting room, they don't know, they don't have any idea of what their blood pressure is. It's dangerous. Why? Me them in Yario, Menko Hospital, 2 years in Menko, it is very dangerous. They are the types that they will come to the hospital and then their relatives said, oh, for 10 years, he has never had to visit the hospital. But then he's lying on a bed in the emergency room with a huge clot of blood in his head. Engage in hobbies, engage in relaxing activities. It shouldn't be work all the time. I had a patient who had to sit down. He's an IT guy. I don't know the terms, but he does coding and gets to work at 6 a.m. He sits. He doesn't even get up to go and urinate. And then closes work about 9 p.m. And said, we were not created to sit at one place. It doesn't make sense. One day he came to the emergency room when I was on duty, and he had a heart attack. It's important to regularly go for checkups, check your blood sugars, check your cholesterol levels, your blood pressures. It's important. Where the figures are not good, please consult a physician. Okay. Now we talked about AFib. This is an irregular heartbeat, mostly identified in patients with hypertension. and it would normally form a clot in the heart, and this clot can leave the heart and get enlarged in the in the in parts of the brain and kill these brain cells because it interrupts blood supply. So as much as possible, please, if you are hypertensive, when you see your physician, he will definitely be making sure that he's checking this. As soon as you get to the hospital, your vitals are checked. If your pulse is irregular, it will be identified. If you have been told by some technological instrument that your pulse is irregular, it's good to see a physician and have it addressed. Not all irregular heartbeats though are dangerous, but that type is quite dangerous. So seek medical help, call an emergency service. The paramedics are those who come with the ambulance. They are equipped to give you first aid, keep you alive before they transport you to the hospital. So they keep you, give you first aid to keep you safe till you get the actual treatment. So diagnosing of stroke, medical history, we examine you, we have a tentative diagnosis, then we do the brain imaging, the CT scan, and then MRI, okay, to confirm our suspicion. I'll show you some images. Now, if you look at this image on the left side of your screen, this is a normal brain, okay? Now, if you look at the right, you see this lesion where the brain cell, there's part of the brain. Now, the grayish part of the brain, the grayish part of this image is the brain. Now, if you look on the left image, you realize that there are some areas where the brain cells are darker. They are darker compared to the rest of the grayish part. That is where a stroke has occurred. And this is the type that a clot has blocked the blood vessels and the brain cells have died off. Okay. And so this is a ischemic type. This is one that causes 85% of stroke. Now, if you look at this type, right, this is where the blood has bled, the vessel has ruptured and bled into the brain. Now look at the brain. Okay, the skull is a bony encasement. There's no more space for the brain to go to when something is trying to occupy space. So when you have a person bleeding into the brain like this, and this is a bleed. This highlighted this this area. If you can see, that is the blood in the brain. Imagine this going into the brain tissue and destroying the brain tissue. They hardly survive with this happening. So treating the stroke, we have the clots in the blood vessel. Sometimes the drugs can be quickly used. There must be indications. It's not automatic that you qualify when you have. Sometimes there are conditions you have that will predispose you that will disqualify you from getting this clots, medications that will dissolve the clots. And one vial is 8,000 cedis. I mean, if you need 2 of it, that means you are pushing for 16,000 cedis. And it's not even so common. You have to be combing parts of Accra to get it. Okay. There is the mechanical thrombectomy. That is technically in layman's terms, we put a guide wire, a wire through the blood vessels to go into the vessels of the brain. And it's not all the small vessels of the brain that this wire can go through, but if it is one sizable blood vessel that has been blocked in the brain, this wire would help remove the clot from there. And we've seen people within 2 hours, they were identified of having a stroke. They couldn't talk, they couldn't move. They were on the table, the guide wire pulls the clot out, and you can just see them walk off the table just like that. Everything reverses. This is when you have not identified that deep, dark spots on the brain. That means the brain cells are not dead yet. So within 2 to 4 hours, if this is done, you can reverse the stroke. But the procedure is costly. I know it's done at Uracare. Actually, it's the only place I know it is done. It's $12,000, not cedis. $12,000. Post-stroke complications, survivors have issues with mobility. That means they can't walk around, speech is difficult, daily activities, they need help all the time, they need to be fed, they need to be bathed, they need to, depending on how bad the severity is, the dependency goes along with that severity. I had a man who came to my consulting room. That day I shed tears. He was in the room, he had soiled himself, and he couldn't speak so well, but you could, if you listen carefully, you can hear what he's trying to say. He was screaming for somebody to come and help change him from his excrement because he was in adult pampers, but everybody else was in the hall screaming at a football match and they couldn't hear him. When he came to my consulting room, he said he wanted to commit suicide, but even the disabilities he had wouldn't even help him to even commit the suicide. Okay, Christmas time, festivities time, the family is exhausted with taking care of these patients that are moribund at home. They can't do anything for themselves, most of them. So they'll come and dump them in the hospital with a good excuse that, oh, this is happening, and then they'll disappear. So Christmas time, you see them just bringing their relatives to keep in the hospital because they want to enjoy the festivities. And you can imagine the emotional toll that this patient would face. Like your family you are a burden to your family. Like you can't do anything to yourself. Psychologically, you are destroyed. Don't let a stroke happen to you. Post-stroke care needs long-term support. They need emotional care. They need family support. And the family that are even taking care of these bedridden, these patients, right? They even need support themselves because it's not easy. It's emotionally draining, physically, financially draining. If the person hasn't died, it costs you even more. We don't wish death, but it is so, I mean, marriages have ended, relationships have gone awry. There are support teams, stroke support groups that people can join. You have devices that can help you move around. I mean, physical activity. I mean, the physiotherapists can help in that regard to bring you back to, I mean, depending on the severity of the stroke. So take home message, I'm here to say that you need to promote a healthy lifestyle. Know your risk factors. If you have risk factors, you need to be extra cautious on the way you live. Physical activity is very important. It's an emergency. So as soon as you identify, please try and get the person to hospital so that if something can be done, it's done immediately. Okay. And please note how to identify these risk factors. Okay. I'll end here. I know there are lots of questions, so let's end here so that we can.
Thank you very much, Dr. Duke Kwaku Agbodeka, for such a splendid presentation. I like the parts where you made it clear that the parts of the world that we are in, you cannot afford to take such risks. You cannot afford to live risky lifestyle. And I hope everyone heard one of the procedures is about $12,000 US. You can quickly do the mathematics and you realize the need for us all to possibly prevent this in ourselves and that of our relatives and friends as well, because it's quite expensive to treat and you can easily prevent it. So that is why we are having this education. Thank you very much. Now, at this point, if you have any questions, please feel free to put in the comment section, in the chat section, and let me read it out to Dr. Duke so that he can answer all your questions. Dr. Duke will answer all your questions. Please put all your questions in a chat box, in a comment section, and he will gladly answer all for you. Thank you very much, Dr. Duke, for such a wonderful presentation. I enjoyed myself, and it was very staggering, the statistics you gave from your personal experience. I hope people were listening. How you were able to admit about 15 people, about half of those could be patient of stroke, and about half of those could die before the day ends. That is how serious it is. Please, if you have any questions, put it in the comment section, in the chat box, and Dr. Agbodaka will gladly answer. He took his time, he presented all the things for us all to understand. There were no jargons, everything was to everyone's understanding. If you have any question, please. Yes, the recording will be shared on the Zoom, on the YouTube channel. So yes, Mr. Russell, you can just go to the YouTube channel. I'll share the link, subscribe, and put the notifications button on so that when I share the recordings, you will gladly have it. I'll share the recording a few minutes after the presentation. Thank you very much. For our friends who join us late, just subscribe to the YouTube channel and you have all the recordings there, as well as the previous recordings as well. So if you have any questions, please feel free, drop it in the chat box and in the comment section so that Dr. Duke can help us. Somebody say recently, a friend of mine, 35 years with high BP, said his doctor was refusing to administer BP medications to him due to his age. Clement, please come clear. Your question is not clear on what you mean by that. What is the BP of the person? What BP readings does the person have? We need to know that. Because you can be hypertensive, but you may not have to be on medication. If it is well controlled and you have your lifestyle modifications in place, you may not have to be put on medication. So can we know the BP readings of the person to know why the doctor is saying he may not need medication? Someone is asking, is brain shrinkage related to stroke? Brain shrinkage is related to stroke.
Okay, let me take Clement Osei's concern first. So good. Yes, as Dr. Sedon here said, I don't know what there's okay. So the BP was 140/90. That was borderline. So you don't look at just one value of high blood pressure and then start patients on medication. In some cases, lifestyle can control the blood pressure. So you don't just see a patient today blood pressure, because when you start the person on antihypertensives, the chances are that the person is supposed to stay on it for a very long time. So the diagnosis of high blood pressure, hypertension, must be done properly. So normally you would hear doctors say, give us a blood pressure profile, check your BPs at home, give me a 2-week reading, do it morning and evening, and then we find averages and look at the trend of the blood pressure. And if it's above the targets, then we have to start you on medications. So we are careful in diagnosing somebody of having hypertension. So we have to take our time in doing it. Then 140/90, if this person is physically active, cuts down on the indomies and the preserved meals, takes lots of vegetables, cut down smoking, alcohol. I'm not saying he's doing all that, but increase physical exercise and all. He might have values that might be normal, and this might be a one-off thing. Okay, so I don't know the circumstances which are surrounding this though, but we don't jump to just start patients on BP medication. We have to be careful. The other thing about the question about brain shrinkage. Brain shrinkage is not a stroke, although it can occur. It can cause a stroke to occur. Now, as we age, we lose the substance of the brain. So it's called atrophy. The brain substance tends to become smaller, and it will happen to all of us. I mean, as we grow old into your 60s, 70s, 80s, that happens. It really doesn't cause conditions, but then you notice that as you are growing, you are becoming less forgetful, more forgetful, you are losing certain cognitive functions and all that. And that's how the body tends to wear and tear as you grow old. Okay.
All right, thank you very much, Dr. Abubakar. There's a very important question in the chat box that says that both of my parents died young from stroke. I know that places me at a high risk. Is there any specific indicator I should tell my doctor to pay attention to?
Yes. So the name is Gakenki. All right. So the thing, yes. The thing is, you need to know what your parents' risk factors were. Were they both hypertensive? Were they both diabetics? It would have been good. I mean, this is past anyway. It would have been good if autopsies were done, but for Ghanaians, we are averse to mutilating the body after the person has passed. So we don't do that much. But sometimes there are genetic causes of these condition, this stroke. And if it were identified, you could receive a lot of monitoring which can prevent you. Either way, you need to make sure that if you have these high risk factors, you need to be very careful with your lifestyle. You need to make sure that you are eating well, you are physically active. If your blood pressures are inching up, see a physician, see a doctor, let him know what your risk factors are. Yes. Because for most people, once the diagnosis is made, he is added an addition that in Ghana, autopsy was never performed. When even I had my doctor to officially, when I had my doctor officially requested, oh, okay, I don't know why that happened to do, but it would have been very helpful. And that's one of the reasons why we do autopsies or postmortems in Ghana, to help identify conditions that might affect generations after the deceased patient. Yes, you can get a BP device. You can get One Touch Select for sugar monitoring. You can get Omron digital blood pressure monitor. Yeah.
All right, thank you very much. Dr. Abubakar, for those people who are using the BP monitoring machines at home, is the machine able to tell them if the pulse is irregular? Somebody wants to know.
Yes. So now the machines are coming very sophisticated. Not the ones we used to have a few years back, but now they are becoming very sophisticated. Some of them can actually identify that your pulse is irregular, but those types are quite expensive. If you get those which are under 1,000 Ghana cedis, the likelihood that they may be able to tell you that you have an irregular pulse it's unlikely that they'll be sophisticated enough to give you that. But then they are very sophisticated types now. They are quite expensive, and they'll be able to tell you that yes, the pulse rhythm is abnormal. Yes, there are also the iOS. I think the Apple Watches, some of them have been designed to identify these irregular pulses. We attempted to, some groups in the medical profession, the cardiologists were attempting to do a project on this, and we were investigating which best tools we could use. And the watches, the Apple Watches, have been identified to provide this kind of identification of whether your pulse rhythm is normal or not. Yeah.
All right. So somebody also wants to know, Doc, is it possible for someone to recover fully from stroke, even if it is not taken care of within 24 hours? Is it possible for someone to fully recover?
Yes, it is. It is. So a stroke depends on the part of the brain that is affected, and then the severity So if you have the stroke in an area where major functions are not undertaken by those brain cells, you might have had a stroke and will not even identify any symptom on you. So we go doing a CT scan for something else and we find out that, oh, you have had a stroke before, but you are talking fine, you are able to see, you are able to speak, you have no difficulty swallowing, you have no difficulty moving around. Yes, so people may have a stroke, may have some weakness that would last for a few days. They undergo physiotherapy and then they will recover fully. They will recover all the functions fully. But that is an sort of what we call this thing, a herald symptom. I mean, it tells you that you are at risk of getting a worse outcome. So you need to make sure that it doesn't happen again. When you've had a stroke before, you need to make sure that you are all the things I talked about, monitoring your figures, being physically active. You need to pay close attention to it, that you don't have another event that is more debilitating than the first one. Yeah.
All right. Dr. Duke, please, does it mean that if somebody has a stroke because of uncontrolled hypertension, the person will have to be put on medications, BP medications for life?
Definitely. Definitely.
Good.
That person needs the BP medication. If you had a stroke that was caused by hypertension, I don't see any doctor taking you off hypertensive medications. You need to be on it for life. And in actual fact, most people, when they have developed hypertension, it only gets worse. Only a few people get off antihypertensives once they are started on it. So we need to be very sure that we have to start you on it.
All right, good. Thank you very much. Dr. Duke, with your experience, I know you have a decade plus experience as a medical practitioner. Can you help us through the financial aspects when it comes to stroke management? Let's say a person comes to the ER, the emergency room, the cost of the CT scan, the cost of the hospital admission, how long are they likely to be in the hospital for before they are likely discharged? So people know what they may be risking if they decide to be non-compliant to their medications or engaging in certain risky lifestyles.
Okay, so I think that I'll give an example, but it varies depending on the complications. That it varies depending on the complications each patient faces. But I'll use a patient that had hemorrhagic stroke or a bleed in the brain that we discharged about a month ago. So he came to the hospital, was found unconscious. He was supposed to get out of bed and couldn't. They had to break the door and found him still unconscious, and it took him a whole month before he woke up. So we managed him in the hospital for about 2 weeks. Even after the 2 weeks, he was still not conscious or was not even opening his eyes. So we had to move him to a special hospice in Mampong where the care is continued. So when you come in, I can't say much about the hospital bills, but then the CT scan that you would need, the investigations, CT scan will be between 600 and 800 Ghana cedis. The cost of the various investigations to look out for the risk factors would likely cost between another 600, 800. And then the drugs are the most expensive ones. So you'll be looking at not less than 5,000 cedis for that initial care of the patient. And this is even in a public hospital. Mm-hmm. And if there are other complications, that cost may even be more. Now, the thing is that it's not a one-time thing, because when the patient comes to the house, yes, because you are not experienced in handling stroke patient, you will have to employ somebody to come and help you in the house. home care nursing, they will charge you. You will pay. You see, you have to be tending this patient every 2 hours and you will not know how to do it. If there's a tube running through the nostrils that go down the throat into the stomach to feed this patient, it's very difficult for the family members to do it. So they would rather want a home care nurse to do that. And then the patient might have developed bed sores because he or she is not able to move. So they need a home care nurse. So it's not a one-time cost. It's a long-lasting cost. And then who would stay in the house to take care of the patient? Even if the home care nurse, somebody has to be around. I mean, when there's an emergency, you will be called from work to come and pick this relative back to the hospital. And especially when they are really that bad and they can't do much for them, they develop complications a lot. When you are moving around, it's very difficult for you to get chest infections or urinary tract infections. But stroke patients get that a lot because they are immobile. They get constipated, get bed sores. The bed sores gets infected. They get contractions. That means that the limbs that used to move, now they become stiff and they are stuck on the body like that. You can't move them. You need to pay for physiotherapy. So a physiotherapy session once or twice a week, you need to pay for all that. Stroke is costly. It's very costly.
That is very important for us, all of us to know. And this is coming from someone who has first-hand experience managing stroke patient in an emergency room in the Ridge Hospital. That's the Greater Accra Regional Hospital. He just made us understand that the initial contact, you're spending about 5,000 Ghana cedis. The question you should be asking yourself is, how much is your salary? That you are going to be covered 5,000 Ghana cedis in the initial phase of the management. And then afterwards, you're spending about 10,000 to 20,000 plus on I don't know how long. So the best advice is for us all to prevent it. A very important question, very controversial though, but we pray for your answer. What is the truth in the link between sex and sex positions and stroke?
So there's no, let me say that it's not because of sex and sex positions that people get stroke. These people were going to get the stroke anyway. Do you understand? Yes. So the sex position would, let's say, would cause a strain on these blood vessels and it will rupture. Okay. If you understand, it's like you were at risk of getting a heart attack, and then, sorry to say, somebody, a Ghanaian, we are watching football, and somebody was supposed to score the penalty, and the person played the penalty, and in your excitement, you just shout, "Hey!" Then you have the heart attack, and then you fall down. It's because of the excitement. The excitement causes elevations in your blood pressure. Sex positions like that also. You realize that when you are in that intimate position, a lot of vigorous activity is going on. Your blood pressure will be elevated, and that is what leads to. So it's not because of the sex or the sex position, but these people were on the way of getting the stroke anyway. The sex or the sex position just triggered the event. But if they didn't have the risk factors, if they were not at risk, sex and sex positions do not give a stroke.
All right, you heard from the expert. Now you heard it's not about the sex position that causes the stroke. That person, like he rightly said, is already at risk of having a stroke. Could be precipitated by any other thing else. Unfortunately, it was the sex that possibly precipitated it. It means if the person did something else, it could have still
exactly.
So it's not the sex. So those of you who are not at high risk, feel free and do what you have to do if you want to do. Any more questions, please feel free, put your questions in the chat box and in the comment section. Dr. Duke Agudeka is online. Few minutes more to go. He's willing to answer all your questions. Thank you very much. Thank you very much. If you have any question, please feel free. Feel free. Somebody says it's quite a relief hearing that he can feel free to change styles. Jephthah. Okay, Jephthah. All right. Any questions? Please feel free. You have a few minutes to go. Put your questions in the chat box. Dr. Duke is answering all our questions concerning stroke and how to go about it. It's very practical, and it's good to know that he's at the forefront, seeing stroke patients almost every week, and how people are losing lives, how people are losing their life due to stroke. That's why he's on this campaign to educate as many people as possible. Thank you very much. Any more persons with any questions? We have a few minutes to go. If you have any questions, drop in the chat box in the comment section. Does National Health Card cover stroke treatments?
Yes, thank you. So it would cover a bit of the drugs, a bit of your accommodation in the hospital, but then it doesn't pay for the CT scan that is needed. So that one you have to pay out of pocket. But National Health covers the hypertensive drugs, the diabetic drugs that you will need in case your risk factors were as a result of these conditions. Yeah. But then for the CT scan in particular, the National Health Service does not cover it.
All right. Yes. Thank you very much. Yes, I know that sometimes even with the CT scan, sometimes they may have to even do a higher one, which is the MRI, which is
an MRI. Exactly. Yes.
So the cost, like Dr. Duke said, stroke is very costly. I'm just quoting him. Stroke is very costly. So the aim is for us all to know how to prevent it. All right. Any more questions? Any more questions? We have a few seconds to go. We've had a thorough presentation. Those of us who are joining us late, please, the presentation, the beginning, everything will be shared on the Zoom, on the YouTube channel. So if you join us late, just go to the YouTube channel. Somebody said, if you say I should eat very well, what should I eat?
Okay. All right. So in actual fact, your meals should have lesser of the carbohydrates, or what we call the calories. And when we say calories, we are talking about the banku, the things that contains the carbohydrates or the starch. So ideally, not more than 50% of your plate should be of rice or banku or fufu. Okay, not more than that. Then you should have 20 to 30% of your plate being proteins, and then the last bit being the vegetables and the nutrients. And so a lot of us, I mean, the economic downturn that the country is living in right now, you can't afford fruits and vegetables always. But I mean, you need to try your best and live a healthy lifestyle. As for the things like Indomie and I mean, what they call the fast foods, frying the meat all the time, frying the fish all the time, they don't help us. Okay, the oily stuffs, they raise our blood cholesterol. They raise our blood cholesterol a lot. So we have to be very careful, extra careful.
All right, thank you very much. Fortunately, last few weeks ago, we had a dietitian take us on how eating. So those of us who are interested, if you go to the YouTube channel, you see a whole presentation.
Perfect.
Yeah, so a whole presentation is done there for us all to know what to eat and what not to eat. And it's all a detailed presentation on the YouTube channel. Now, somebody is asking, what are the main response centers in Accra in case somebody has some symptoms of stroke?
So the main response centers, when you are sure it's a stroke, it's ideal that you go to a center where you can have a CT scan. Korle Bu, Rage Hospital 37. Now we have UGMC. We have, then we have the private hospitals that have the CT scans and all that. We have the University Hospital Legon. This is just a few of the places, but there are places where, I mean, Accra Medical Center, there are private places. It depends on the cash as well. Some places you might not afford, you might not be able to afford. The thing is that when you go to a lower center, you might have to go through a lower center before coming to a tertiary facility where a CT scan can be done. It's a lot of time wasting. That is the thing. And that's why I am begging everybody to try and make sure that you don't enter such a situation. Now, I have given some scenarios where you can say that this is a stroke, but without a CT scan, you can't say for sure that
Yes.
it's a stroke. So before we are able to address the concerns, I mean, be able to say that we need to do this quickly to relieve the stroke symptom, a CT scan has to be done, because a tumor in the brain can look like a stroke. Some brain infections can look like a stroke. Okay, and that's their treatment also is something different. Okay, so the brain imaging, a center where brain imaging is done. So um whatever it is, immediate attention and referral to a higher facility so that a CT scan is done there, so that the immediate care is given, is the most appropriate thing. Yeah.
All right. Thank you very much. It's been a very refreshing presentation. It's been very, very thorough. He's gone through everything that we need to know about stroke and prevention. His target has been on prevention, especially because of the part of the world that we live in. If you have a stroke, chances of you getting to a center on time for the reversal to be done and for you to be able to afford it, it's very slim. So the best approach is to prevent it. Thank you very much, Dr. Duke Agbodoka, for such time spent with us. We appreciate your service to us. For us, we are grateful, and for us, if you do well, we are likely to invite you again. So please, just like Oliver Twist, we may call on you once again. Please, everyone, join me. Say a very big thank you to Dr. Duke Agbodoka, such a gentleman, such a well-learned person. He's got experience up his sleeves, and he's advising all of us to lead healthy lives, to prevent stroke, to be compliant on our medications, to take our regular medical checkup very seriously, and of course, to spread the good news. Those of us who joined us late, the presentation, the recording will be posted on the YouTube channel a few minutes after we are done from here. And there are a lot more other presentations, including from especially dietitian teaching us how to eat healthy. Everything is on the YouTube channel. So feel free, subscribe and put your notifications button on. Share, help me share the link to have your friends go and have fun on the YouTube channel to learn more about health. All right. Thank you very much, Dr. Duke. We appreciate your time. Do you have any final words for us?
So, well, the final word, I think I've said it all. I kept on stressing it. It's just living healthy. Yeah. It's just making sure that you know your risk factors. And if you know your risk factors, you know that no, what others are doing, I can do. So when you go and sit with a group of friends and they are drinking, you know that no, it will be costly for you. So even if you drink in moderation. Let's be very conscious about that fact, about our health. We are gaining too much weight. We need to put in efforts to reduce our weight. We need to be physically active. We need to eat healthy. We need to take our medications if we are on medications for chronic conditions that can predispose us to a stroke. Know your figures. It's important. Your weight, your height, your blood pressure, your blood sugar, your cholesterol. Every year, you just at the beginning of the year, it should be part of your New Year resolution. You do that, save money, you do that. And then anytime in the year you are asked, you can just present that this is what I had at the beginning of the year. It's enough. For people who are at higher risk, that is hypertensive and diabetics, it's needed that you are seen every 2 or 3 months regularly, and your figures might be you have to monitor your figures more frequently. So it's important. This is the message I leave with you.
All right. Thank you very much. Thank you. I should have asked this question earlier, but it's never too late. Doc, by all that you've told us, are you trying to tell us stroke is not caused by witches and witchcraft?
Oh, I believe that even if they are caused by witches and witchcraft, you have given them a chance to. So deal with your risk factors. If you don't have risk factors, it's very difficult for them to use stroke as a weapon on you. Yes, we need to
Thank you
add
very much.
prayer. I mean, some of the times we'll search and will not find the risk factors, but a lot of the times we are able to identify that this person has not been doing what he should be doing well enough.
All right.
So in all these things, add prayer, okay? But then live a good and healthy lifestyle.
Thank you very much, Dr. Duko Kwak-Bodeka, for your time spent with us. We appreciate you. Please, everyone, join me in the comment section to say thank you, Dr. Agbodeka, so that he knows that he feels appreciated for his time spent with us. We appreciate you. And of course, once we need you again, we will come to ask for your help once again. And all of us, once again, thank you for making time to join us. Those who have not subscribed yet to the YouTube channel, please feel free to subscribe to the YouTube channel so that you can benefit from the recording and that of the previous recordings from with other topics that has been done in the past weeks. Thank you very much. Until I come your way once again, this is Albert, Dr. Albert Sedun here.